Wes Streeting, as always, really good to see you. We've had the most extraordinary 24 hours, some would say chaotic, in Parliament yesterday, and today we saw the Chancellor in tears on the front bench. Do you know what's up with the Chancellor?
Well, I think the two things are separate. Rachel, as a team have said today, has something going on personally, not professionally, and it's easy to forget, but we are all humans as politicians, and we have lives like everyone else. But in terms of yesterday on the vote on welfare and the evolution, shall we say, of the bill, I think it's fair to say that there's been a lot of concern, not just amongst Labour MPs, but amongst disabled people, disability organisations. And we all want to get this right, because what we're trying to achieve with welfare is to make sure that the system is there for everyone when they need it, that it's there for our country for the long term. And fundamentally, what's wrong at the moment is we've got people who, through no fault of their own, simply cannot work through severe illness or disability, who don't receive sufficient support. We've got disabled people who want to work, can work, but struggle to find work, not receiving support, and we want to help people to be able to do that. And the welfare bill is growing at such an extent that by the end of the decade, it will be roughly half what we spend on the entire National Health Service and more than we spend on national defence. So we've got to make sure it's sustainable for the long term. Now, I think
But just on that, you are on the modernising wing of the party. It looks to people like me that because you rushed it, it's now going to set you back years to actually make the system affordable. That must really upset you.
Well, two things. Firstly, I'm a product of the welfare system. When I was growing up, it put food in the fridge and money in the electric meter.
But you believe in reform?
Of course, and I also believe in the welfare state. And I think you hit the nail on the head when you used the word rushed. And I think we would accept in government that we were trying to go too fast. We didn't take people with us. I don't think it set us back years, but I do think that in terms of the Tim's review that will be looking at how we get the sequencing right, how we make sure we deliver on the reform agenda that the overwhelming majority of Labour MPs sign up to in terms of the principles, the aims, the goals. I think we've got the right sequencing now.
But do you think you can make savings during the lifetime of this Parliament?
I do. I think
it's going to be hard,
I think
given you're not going to get the Tim's review for 18 months.
Well, the review will report next year. We will then act on the basis of that review, and crucially, we want to do this with people rather than to people. And I think people will take much greater confidence in the reform agenda, which has to sustain. It does need public support. I think we'll be able to take people with us if we get the sequencing right. And I think it's not been the smoothest process. I'm not going to pretend otherwise. But I think where we've ended up is in a much better place, thanks to the engagement that we've had between Labour ministers and Labour MPs.
And on the fact that it was rushed, the reason for that was because the Chancellor and the Treasury forced savings on the DWP before they had actually had a chance to review the system. This was a mistake made by the Chancellor. Does the Prime Minister still have confidence in Rachel Reeves?
Of course he does, and let's not underestimate not just the scale of the challenge that the Chancellor faced when she walked into the Treasury this time last year, but also where we are as a country today thanks to the choices she's made. We've seen interest rates fall 4 times in a row. We're finally seeing wages rise faster than the cost of living. Those are no small achievements, and to have the fastest growing economy in the G7, that is no small achievement either. Now, we're not pretending...
So what you're saying is everybody is allowed to make a mistake in their job, even if it's a really big one?
No, I think it's more, actually, that when the Chancellor came in, there was a massive black hole to fill. There was a lack of business and investor confidence in the UK. She's created the stability. She's created the conditions for our economy to grow. And that is so important, because when you're the Chancellor of the Exchequer, you get people coming at you all the time, myself included, saying, I've got really good ideas, I've got things I'd like you to spend money on, and it's not just cabinet ministers. You know, the Chancellor carries on her shoulders the responsibility not just of the public finances, but she cares about the family finances. She cares about the finances of every business in the country. And when you're in her position, the most important quality you need in a Chancellor is the toughness and hard-headedness to be able to say no to people. And that's what Rachel has in spades. And it's why, with the choices she's made, not always the most popular choices, the choices she's made is creating the conditions for our economy to grow. And if the economy grows, all of the other choices become so much easier, as you know. You can invest in your public services without hiking taxes. You can put more money back in people's pockets. And people wouldn't thank her if she ducked the difficult decisions. And we are
still
all
not
with her in
denying
that.
she made quite a big mistake, though, by imposing these cuts.
We've got to remember that in terms of the fiscal challenge that she came into, which is a shared challenge, it's not just Rachel's challenge as Chancellor. This is something we approach as a team. There are enormous challenges.
Sure. OK, I need to move us on. You, as a minister, invested an enormous amount of time in talking to your MP colleagues about the reforms that you believe are necessary for the health service. Downing Street conspicuously did not listen to the concerns of MPs about this welfare reform. What are the lessons that Downing Street has to learn?
One of the reasons that we landed in a much better place on welfare reform was because of the Prime Minister's personal intervention and knocking heads together.
But too late, because it looked like chaos. It was chaos.
No, I think it was...
They should have been listening earlier, surely weeks earlier.
Well, as the Prime Minister said, we all wish that we'd got to this point earlier. I'm not going to pretend that the process was easy or straightforward or the ideal process, but the point is we did land ultimately in the right place. We're in a much better position now than we were even a week ago. The welfare reform agenda is extremely important. It's important, as I said, for the sustainability of the system and also for meeting the needs of people across our country who are often at the sharp end of life. And that's why that Labour MPs have taken such care, as have Labour ministers, to get this right, because none of us want to be in a constituency advice surgery on a Friday afternoon and have some disabled person walk through the door and say, this has really impacted on me, this has really hurt me, and to sit there thinking, well, we never intended that. That was the worst thing to happen. So it's important we get it right, and that's what we're doing.
I want to move on to the 10-year health plan in a minute. One final question in all of this. When I talk to backbench MPs, actually their anger isn't as much with Rachel Reeves as it is with Morgan McSweeney, the Chief of Staff to the Prime Minister, who they think was tin-eared and trying to push through something that was unacceptable. Do you think, as they do, that he needs another job?
No, I'd say two things. Firstly, it is the easiest and laziest thing in the world to blame the advisers. Advisers advise, ministers decide.
So it's the Prime Minister's fault?
We take responsibility. The Prime Minister, me, the whole team, we take responsibility. And, you know, the Labour Party would not have been electable and would not be in government without Morgan McSweeney. And so I just say to colleagues, we're not always going to get things right in government. We are going to make mistakes, and always raise them with us. We listen, we learn, we adapt, we change, we move on, and that's what we'll do. But advisers advise, ministers decide.
One of the reasons why the welfare bill for disabled people has been rising so sharply is because of the NHS backlogs and also because of the shortage of mental health specialists within the NHS. You are publishing your 10-year plan. When will we, British people, feel a tangible difference? When will actually the numbers going on to disability benefits start to slow down, start to fall, because the NHS is being fixed?
Well, there are already signs of improvement and delivery. So,
but they're not showing up in numbers going on to, PIP, personal independence payments, for example.
No, and that's one of the reasons why we also need to reform the welfare system. But on the NHS, we came into government and we said we would deliver 2 million more appointments to help cut waiting lists in our first year. We're not yet at the one-year anniversary mark, almost there, and we've done more than double that. Waiting lists are at their lowest level in 2 years. We've taken 250,000 off the waiting list total. So things are beginning to move in the right direction on waiting lists. We promised to recruit 8,500 more mental health workers. We are now over 6,000 in place on GPs within days of coming into this office. I said that we'd deploy 1,000 more GPs onto the front line. and within our first year, we're actually on over 1,900 now. So things are beginning to improve. Now, there'll be people watching who are probably now beginning to shout at the telly saying, hang on a minute, I couldn't get through on to the GP this morning, but I'm still waiting. And just to reassure people, I absolutely know that, and I'm not going to be satisfied until the NHS is delivering the right care in the right place at the right time and for people to feel the change. But the reason I point out the things that we've delivered is to reassure people that change is underway, change has begun, and actually you'll find with me as your Health and Social Care Secretary, my record is actually one of under-promising and over-delivering. And at a time when trust in politics is low, I hope that reassures people that we are beginning to really get this NHS in the right direction, because as the 10-year health plan will set out tomorrow, we've got to get our NHS not just back on its feet, but fit for the future. And there's a world of opportunity for the NHS and for our country if we deliver this 10-year plan as we will.
But 10 years does sound to many people like jam tomorrow. Will they feel that the NHS is delivering in the way that we all hope and expect before the next election?
Yes, so on waiting lists, for example, on waiting times, we've committed to do something within this Parliament in terms of cutting waiting lists that even the last Labour government didn't deliver at the height of its success in terms of the pace and rate of change.
Pace, but they're still ridiculously high.
They are, and they won't be by the next general election. And I'm determined by the next general election, as the Prime Minister's tasked me to do, to get the waiting list and waiting time standard back to the 18 weeks that it always should have been. Was under the last Labour government when we delivered the shortest waiting times and highest patient satisfaction in history. We did it before. We can do it again. We're on the right course. And I know people are going to have to judge me on the results. That's exactly how people are going to judge me in this government.
Now, there are two other big areas I want to talk to you about. One of your big plans is to put much more resource into prevention. We have an epidemic of obesity, particularly among children. A huge amount of the contributor are these appalling ultra-processed foods. You are working in partnership with the supermarkets, with the big chains like McDonald's, to try to get their agreement to try and limit the sales of this stuff. But this stuff is toxic. Aren't you just being soft, weak on what is a huge cause of ill health?
No, we're being radical and ambitious. And what we've agreed with
why that's
what we've got with the
ambitious.
supermarkets, for example, is a radically different approach to public health.
But you're not ordering them to put up the prices, taking more tax from them. You know, you're not ordering them to take this stuff off their shelves.
No, we're doing something that's, I think, far more radical and is going to be far more impactful. Supermarkets, in terms of the data they have on all of us as customers and what we're buying, they have some of the best public health data in the world. And what we're agreeing to with them is that they will publish that information. We will set a target to make the average shop more healthy. And then supermarkets, with all of their insight into all of our behaviour as customers, and with their purchasing power from in terms of where they get their supplies from, the produce they put on their shelves, they will decide in terms of how they market, how they price their products, where they place their products, and all of the things that they do that drive our consumer behaviour. They will make our shopping healthier.
Will it all be voluntary, or will there be coercion here?
Well, the targets and the approach will be mandatory, but we're doing it with rather than to supermarkets. It's going to be if we get this right, it's going to be game-changing. It's going to be far more impactful than even things like the sugar tax in terms of driving consumer behaviour. And crucially, because what you described, Robert, is the sort of the conventional way of doing public health, which is very big state. It's very, ministers either taxing us more or determining where particular produce goes on the shelves, what can be marketed by whom, when. And I just don't think that works.
You've got to trust these big companies, though, to be genuine.
But the data doesn't lie, so we'll judge them on the results. And crucially, I've not had to twist their arm. You know, the people who run supermarkets, they've also got kids. They also care about the health of the nation. But what they've told me is that when they've tried to do the right thing on their own, they've lost profits and market share. So, for example, one retailer said, look, during the World Cup...
And you think you've got them all on board,
Yeah, I certainly have. I mean, so take this example. So during one of the World Cups, a retailer decided that they weren't going to do the usual alcohol price promotion, not least because there's a lot of pretty depressing data that shows that during the World Cup, domestic violence goes up. So they got rid of those promotions. Do you know what happened? They lost profits and market share because they did it on their own. But instead, we're going to do it together with supermarkets, and that's how we're going to make. That's how we're going to make the healthier. Well,
there will
the
be
healthier choice, the easy choice. There
will be one or two who will exploit what you're doing. It'll be interesting to see whether you do manage to get them all on board.
The data doesn't lie. We'll keep a beady eye out.
I've got one final question for you on another big issue. Back in March, the National Audit Office came up with a forecast that said that by 2036, the NHS's employees will rise to 2.3 million. That's 70% increase. 120 billion in wages would be being forked out, excluding GPs. Are they right that even in a digital artificial intelligence world, we're going to have to see 2.3 million people working in the NHS?
Well, worse still, Robert, on the previous government's workforce plan, over the course of the century, if we carried on their trajectories, we would see 100% of the population working for the National Health Service.
Which is sort of my point.
Yeah, exactly.
So I'm just asking you.
It's absurd.
Where are we heading?
Yeah, it's absurd.
In terms of the size of the workforce and what can be automated, what AI can do.
As you'll see in the 10-year plan tomorrow, there is a big emphasis on the revolution that's taking place in life sciences and medical technology and in automation that is going to enable us not just to liberate NHS staff from a load of dull, routine admin tasks that they do, but to free up time that will enable us to see more patients. For example, with ambient AI technology, which is where when you're in a consultation with a GP, instead of them looking at their computer, tapping away and having to look over their shoulder, they will record the interaction, all of the notes will be written up, even the follow-up letters and referrals will be processed in an automated...
It's crazy it's not happening already, if I'm honest.
Yeah, and you know, if we just saved 90 seconds in every interaction the patient has with their GP, we would create the equivalent of 2,000 GPs worth of time. Exactly. This is the game changer. This is how we make sure that healthcare in our country is not just more responsive to the patient, there's more ease, more convenience for the patient, more choice and control for the patient. This is how we make the NHS financially sustainable for the long term, because this is the jeopardy and the pressure I feel. It's not just to recover the NHS from the crisis it's in today, it's to make sure the NHS is sustainable for the long term, not just back on its feet, but fit for the future. That's what the 10-year plan for health does. I hope it's a plan that people will feel as excited by as I am, and most importantly of all, at a time of rock-bottom trust and confidence in politics, politicians, the ability of government to do good, I hope this reassures people watching that what we created in the 20th century, an NHS that's there for you when you need it, based on your need, not your ability to pay, will not just survive but thrive in the 21st century. That's the historic calling of the Labour Party and this Labour government, and we are going to do for this country in the 21st century what Attlee and Bevan did in the 20th.
You got your advert in. As always, Wes Streeting, very good to see you.
Good to talk to you.
Be sure to like, subscribe and turn on all post notifications to catch the ills, spills and thrills of the mad, mad world of politics.